Good afternoon, ladies and gentlemen. Welcome to this new segment of Medcast, which is your new gateway to the latest medical updates and the rumors and the reply to the rumors in the society. We are so pleased to have today Dr. Dhari AlEnzi, who is specialized in prosthodontist. Welcome, Dr. Dhari, again.
Thank you for having me again.
We are so pleased to have you.
Thank you.
Dr. Dhari,
Me
in
too.
the last segments we have discussed what is related to the veneers, but now we need to discuss more important topic, which is related to the implants.
Yes.
First of all, when, as an expertise, when do you decide to use the implants?
To use the implants. The implant is a great treatment option, but let's start with the history of the implants. How about
Yes,
that?
I like hearing stories.
Okay, here's the thing.
Yeah,
People thought that implants is a new thing. When did you hear about the dental implants?
I
Okay,
think like around 10 years ago.
10 years. It's
Yeah,
been going on for 60 years.
60 years.
60.
So you are
60
talking about like
years.
in around 40s or 50s.
1964 or 65,
Okay,
they started the dental treatment, the dental implants.
that's a very bit
And
long time ago.
it's a medical doctor, not a dentist, who found out.
Hmm.
This guy is his name is uh, how did I forget his name? Um, I do know his name, but I will remember.
Okay.
But this guy, he was doing an experiment on rabbits.
Hmm.
My director in pros, he will be very mad at me because I forgot his name. I do his name.
Hopefully he doesn't see
I
that.
really do his name. I'm organizing an event actually from Noble. It's the same company that he started. But anyway, so he was doing an experiment on rabbits,
Hmm.
and he put titanium screws in the bones of the rabbit, and he was doing something on testing the bloods, and when he finished the experiment, he tried to take the screws that he inserted into the bones. He tried to take them out, but
Hmm.
he couldn't. He found out that there's a fusion between the bone and these screws, titanium screws. Later on, he kind of tried to duplicate his experiment, and he duplicated his studies, and he studied the screws on animals, and then he wanted to study it on humans.
Hmm.
And guess what is the more accessible bone in human body that you can go visit every now and then? It's the oral cavity.
Yeah.
You can just, do the surgery on, place a screw and put it, close everything and look at it 6 months later. So he did the study of implants on on humans, and he found out it's really working. And this is in the 60s. The thing is, he couldn't sell that to dentists. Anything new, everybody's trying to reject it.
Yes.
Everybody's going to say no. Oh, what is he doing?
How could we put
Yes,
titanium
there's
in the
no
mouth?
yeah, on the bone, but they tried to do it before, but it never worked. They tried to do something, and it was more actually involved when they tried to do implants. It was a traumatic surgery when they did implants before. So this guy, he started doing his implants from 1965 to 1970, 15 years, 71, 72. And there's a conference in Canada, in Toronto. Toronto is in Canada, right?
Yes,
Yes.
it is.
Yeah, it was in Canada. And I think 1972, he did this, sorry, not 1972, 1982. He did this, he presented his 15 years of treatment in Sweden. He was in Sweden. He's
Mhm.
Swedish. So he presented to the American dentists, his treatment in Europe of dental implants. So they started thinking about this treatment option after 15 years of this guy making it happen. Later on, they developed the whole concept. They did more studies. They focused on dental implants. So what happened is we have a treatment option. If you lose a tooth, we don't have to cut this tooth and that tooth between the lost tooth
Mhm.
and try to bridge between
Yes,
them.
that's the
Th-
conventional way
This
of,
is, yes,
yeah,
exactly. Now we have something that we can put in the middle there.
and that's
Okay,
it.
exactly.
Mm.
So they studied the whole thing more and more and more. Before that, they only use implants on like edentulous patients
Mhm.
who don't have any teeth, until they started. We don't have to do bridges anymore. And the thing is, like a human mind or a human psychology, you have to convince the old people or the old doctors that we have a new
Technology, let's say.
technology or
Yeah.
new thing going on in dentistry. And usually it starts in universities. They teach the students, oh, we have implants, we have implants. Later on, now it's very widespread,
Yeah.
60 years later. And I do
Finally.
remember I had my mother actually go through dental treatment, implant treatment, and my brothers were mad at me because they thought I was experimenting on my mother.
When was that?
It was 10 years ago.
10 years ago. So
When you
probably,
found out about the
okay, when I
implants.
found out about the implants, yes.
So my brothers, they thought I'm experimenting something new that nobody knows about.
Hmm.
And it's been going on for 60 years. So dental implant is a gateway to making like your teeth younger as it was before. I have so many old patients uh, who I wouldn't say the number because I don't know how old is everybody here. But anyway, who lost their teeth.
So to be in the safe side, let's say more than 65.
Okay,
Yeah.
great.
Okay.
I remember someone he became 40 and he was teaching small like young dentists about the elderly patients, and he was like he saw everybody's very young and he was like, 40 is not old, by the way.
Yeah, it's not old.
And he was
I
40.
believe, yeah, I believe in that. 40 is not old. Let's
Exactly.
agree on that because we
Exactly.
have some people here who's around 40s now.
I
Okay.
know, I know. But anyway, a lot of patients they lose their teeth in an older age,
Yeah.
and let's make
65 and above.
65 and above.
Yes.
Okay, let's agree on that. So whenever you provide them with fixed teeth, because the other option is dentures. Dentures is something you have to remove and put back. It
Yeah.
doesn't bite as much. It
Hmm.
doesn't look as good. The speech is kind of sometimes it falls or vibrates, so you
Hmm.
can't talk. Sometimes you're in a middle of like a serious conversation with someone in a social event, and your dentures fall out.
Falls
It's
down.
very embarrassing. So whenever they had the implants, they fixed this problem for the patients who don't have teeth.
Hmm.
Um, so when we talk about dental implants, it's a gift from God to humanity. If you lose a tooth, you can replace it like nothing happened.
So can we use the implants for only one tooth
Yes, you
or
can.
only for dentures, as you mentioned?
You can. Whenever it started, they wanted to do only dentures
Hmm.
because they will place only 2 or 4 implants and place a denture on top of
Hmm.
them. But the idea of only a single implant for a single tooth was there, but it was not popular
Hmm.
because why do that and we can do a bridge?
Hmm.
How much
Yeah.
faster? Just cut. Next week we deliver the bridge.
And then
Much
there's
faster.
no
One
much
week.
follow-ups as much
Yes,
as
yes,
the, yeah.
exactly. One week and that's it. But later on, people realized that bridges fail,
Yeah.
like any other thing. And when they fail, then you have to pull 3 teeth. That patient had only a problem with one tooth,
Now we
and we
are having with
created
three.
3 problems for him.
Yes.
5 or 6 or 7 or whatever years later. So the idea or the concept shifted from using implants only for the edentulous to using implants for single crown. And I'm talking about the 80s and 90s, the late 80s or early 90s.
Hmm.
Um, so they shifted the idea. The thing is, it was much slower process.
Hmm.
If we place the implant today, we have to wait 6 months.
On that time.
Just wait until, don't touch it at all. 6 months later, okay, have the patient back, uncover the area, put the crown on top of the implant, but it's a very lengthy procedure. You're not in pain during these 6 months, so don't worry about it. You're just waiting. But now they found out with better technologies, better treatment of the dental implants, they can just give it about 6 weeks.
6 weeks.
6 weeks,
Compared to
one month
six
and a
months is the
half,
best.
and yeah, compared to 6 months before.
Mhm.
So it's a great, achievement.
Okay, now I'm very happy because you have started to read my mind because you answered my upcoming question,
Of course, I
which was
know.
about the
It's a
timing.
it's a trick.
Yeah, and the improvement of the procedure. But the
Mhm.
question is, what factors may contribute to the success implementation?
Okay, having a good clean mouth
Hmm.
will help. Will definitely help. Let's talk about the factors that will deteriorate.
Yeah. No,
The
the
treatment.
point is because some people might be frightened if they hear about the bone density or something. That's why
Nah.
some dentists might ask for like vitamin D checks or something before doing the implant. Is that true or not?
Sometimes we do, but it's not. If you're a healthy individual, I don't have to ask for the
Apart
vitamin
from
D.
chronic diseases like diabetes,
If you
hypertension.
yeah, there's some if you never had any bisphosphonates, for example,
Hmm.
this is important to know. If you had bisphosphonate, because it does prevent the healing of the bone,
Hmm.
so we need to know about that. Diabetes, it has to be controlled,
Hmm.
because if you're a diabetic patient and it's uncontrolled, your teeth is the last thing I would think about.
Hmm.
I'm thinking about your eyes, your fingers, your kidneys. So many problems that so many things that could go wrong, including your implants.
Hmm.
Um,
Osteoporosis.
Osteoporosis, it depends. Osteoporosis by itself is fine.
Hmm.
We can place implants. That's fine. Have you taken any medications for it?
Like bisphosphonates, as
Yeah,
you mentioned before.
exactly.
Yeah.
This is our problem is not with the disease itself, with the medication that they fix with the disease.
Hmm.
Because if you think about the mechanism of action of bisphosphonates, it kind of makes the bone so dense
Yeah.
that whenever we place the implant, it doesn't heal around the implant well.
Hmm.
It's just necrotic bone. The bone dies around the implant. So we have to deal with bigger issues. So we always have to check what the medication the patient had. If the patient had any heart surgeries, we need to know ahead of time. It doesn't prevent placing the implants, but the surgeon needs to take precautions before doing the surgery.
Now, the reason why I ask this question, because there are some patients who
Mhm.
might underestimate the importance of mentioning these procedures they have done before,
Yes.
and they think they are not somehow related to the dental
Yeah.
procedures. Now, let's finalize our interesting speech about the implants, and I need you to talk about the factors that may deteriorate the implant, as you have said.
Having uncontrolled diabetes,
Hmm.
patients with poor oral hygiene who don't clean around the implants.
Hmm.
The implants are more prone to infection if you don't clean around it. Um, Having a good dentist
That's the point.
plays a
Yeah.
major role.
Yeah.
A good surgeon and restorative dentist.
Mm-hmm.
A good surgeon needs to know how to put the implants right,
Mm-hmm.
where to place the implant, the angle of the implant. It's really important. How much space you leave for the dentist who's going to put the crown.
Mm-hmm.
It does help whenever I have a good surgeon to place the implants for me. It helps me a lot when I put the crown on top of it. When we talk about the patient, um, mental illness or mental not illness, I would say, um, how aware the patient is not mentally challenged,
Mm-hmm.
that they can take care of themselves. This is very important. I cannot place implants. I had a patient back in the States who thought he was communicating with God through his amalgam filling.
How weird is that?
Exactly.
Yeah.
If you tell me place an implant on this guy, do you think I should place an implant? He's thinking he's communicating with superpowers with his fillings,
And getting
amalgam
the
fillings.
recommendation from the superpowers as well.
Okay, if I
Yeah.
place an implant, he might think he is God, you know. So, so mental illness is one of the factors that we have to
Look after.
yes, look after.
Yeah.
I did have patients, and they had some issues, and I did communicate with the families to make sure that they are safe to practice around.
Hmm.
They're calm. They're not. They can take care of themselves. Sometimes the family plays a big role in taking care of their family members.
Yeah.
So yes,
That's very great. Again, as we are reaching to the end of our segments, there's one more quick question which needs an answer, either yes or no. Are these implants, or let's say the crowns, prone to discoloration? That could be a good introduction for our next segment for later
I
on.
would say yes and no.
Okay, I was just say
It
yes or no.
shouldn't. It
Okay,
shouldn't.
it shouldn't. What I mean, is it like 50-50?
No, no, not 50-50. No, but it shouldn't.
Depends
Good ones will not.
depends on the care
Uh,
the patient takes.
the patient and the dentist and the dental technician.
Okay, that's very great. Dr. Dhari, we are so pleased to have you today. Hopefully, again, we will have you again in our
Inshallah.
program, inshallah.
Inshallah.
Thank you so much for being
Thank
with
you.
us. Our dear viewers, we have reached to the end of our segment of Med Podcast with our dear Dr. Dhari AlEnzi. Hopefully, we can meet you again with another medical professional. Until that time, see you later.